First question I have, my brother just received a stent. Do I need to tell my MD? I don't want all the scans. I have no symptoms. I'm on losartan, which is a blood pressure medicine. My Lp(a) is 24. Thanks. So, my approach to this is it kind of depends on if you don't want scans and you don't want more testing, then I guess you're not obligated to tell your doctor. Your doctor works for you. So this is really about what you think you need for your own optimal health and what the differences are between you and your brother. And, that might mean that there's some genetic predisposition in your family to cardiac disease, and perhaps you would want some imaging, or perhaps not. I mean, it says you don't want scans. So the question is, what is your MD going to do with this information? What are you going to do with this information? And, I would ask yourself why you don't want the scans. If you wouldn't change anything, if you're not prepared to make any changes based on that new information in your family, then, keep doing what you're doing. If it were me, I might want to be scanned, but that is the difference between a doctor who treats individual patients and takes their own thoughts and feelings into account, and somebody who says, well, these are the guidelines and we should all just obey them. I know that there are a lot of people who think that it's my job as a doctor to tell you what to do. It is my job to tell you what the data say and what the evidence says, and it's your job to decide what makes sense for you and what your goals are. So that's a really goal-driven question, and you can answer it best, not me.